Anatomy and Physiology Digestive System. So what we're going to talk about today is an overview of the digestive system, the esophagus, the stomach, the accessory organs of digestion such as the liver, pancreas, and gallbladder, the small intestine, and the large intestine. Here's an overview of the GI tract. You have your esophagus, which starts distal to the pharynx. You have your stomach, your small intestine, such as the duodenum, the jejunum, and the ileum. You have your large intestines, including the ascending, transverse, descending, and sigmoid colon, as well as the rectum, and you have the anal canal. Your accessory digestive organs include the gallbladder, liver, and the pancreas. Let's talk about the esophagus. The esophagus begins in the neck at the pharynx and terminates at the gastroesophageal junction, so it terminates at the stomach. It's mostly located in the thoracic region, which is the chest, although about 1 to 2 centimeters of it is intra-abdominal. It's located posterior to the trachea. Unlike most of the GI tract, its wall lacks a serosa. The upper esophageal sphincter is located in the neck, which is right here, and the lower esophageal sphincter is located at the gastroesophageal junction, the GE junction, and it's a physiologic sphincter. It's not distinct anatomically, and it's physiologic because the pressure is regulated by the skeletal muscle of the diaphragm. So the diaphragmatic crura around the esophagus help it functionally act as a sphincter. Now we talk about the stomach. The portions of the stomach include the cardia, the fundus, the body, the antrum, and the pylorus. The curvatures of the stomach include the greater curvature, because it's longer, and the lesser curvature, because it's shorter. The lesser omentum attaches to the lesser curvature. The greater omentum attaches to the greater curvature. And of course, let's not forget the sphincters. We have the lower esophageal sphincter, which is located around the cardia area, and we have the pyloric sphincter, which is here. And the duodenum is located just past the pyloric sphincter. Now let's talk a little bit about the liver, pancreas, and gallbladder. The liver consists of the right lobe and the left lobe, which is separated by the falciform ligament, which is this structure that I'm pointing to, this membranous structure. We have the pancreas, which lies in the C-sweep of the duodenum. There's a head, there's a body, and then there's a tail. We have the main pancreatic duct, which joins the common bile duct to drain through the major duodenal papilla, the ampulla ovata, and we have the accessory pancreatic duct, which drains out the minor papilla. Both of these ducts eventually drain into the duodenum. We have the gallbladder, and the cystic duct connects it to the common bile duct. Let's talk a little bit more about the lobes of the liver. As I mentioned already, there's a right lobe, and the right lobe includes a quadrate lobe and a caudate lobe. The quadrate lobe is anterior. We're looking at the liver from the back. The caudate lobe is posterior, hence the name caudate, caudal. We have the left lobe, which is smaller, and again, note how the falciform ligament is separating these two. And speak of the devil, the falciform ligament separates the right and left lobes. Oh my. Biliary tree and gallbladder. We have the right and left hepatic ducts, which drain bile from the right and left lobes respectively. These join together to form the common hepatic duct. Once the cystic duct joins with the common hepatic duct, it becomes the common bile duct. And this is the direction of bile flow. And then this common bile duct empties into the duodenum at the ampulla of Vater. Now let's talk about the porta hepatis, the portal triad. It consists of the common bile duct, which is anterior and to the right. It consists of the hepatic artery, which is anterior and to the left. And it consists of the portal vein, which is posterior. And just looking at the cross-sectional area, you got the anterior common bile duct, hepatic artery, portal vein. On a cross-section, it kind of looks like Mickey Mouse. Oh, check it out. Mickey Mouse, common bile duct anterior to the right, hepatic artery anterior to the left, portal vein posterior. Thank you, Mickey. Now let's talk about the small intestine. It consists of the duodenum, which is a C-shaped loop wrapping around the head of the pancreas. It begins after the pyloric sphincter, and it ends at the ligament of Treitz, which is somewhere here. The ligament of Treitz is basically a membranous structure which separates the duodenum from the jejunum. And the duodenum actually has 4 portions. You have the first portion, the second portion, which is where the common bile duct drains into, the third portion, and an ascending 4th portion. We have the jejunum, which starts after the duodenum ends, and is more proximal. And if you want to be strictly academic, there is a difference between the plicae circulares and vasa recta of the jejunum and ileum. I really don't give a crap about any of that, because in the operating room, the way you can tell the jejunum from the ileum is the jejunum is proximal, the ileum is distal, and the ileum ends at the ileocecal valve. Some facts about the small intestine. It's around 20 feet long. The total absorptive surface is the size of a tennis court. And that's because the wall of the small intestine is lined by villi, which increases its absorptive area tremendously. And like I already mentioned in another lecture, most digestion and absorption happens here. Let's talk about the large intestine. It consists of the colon and the rectum. The colon has several portions. You have the cecum, which is intraperitoneal. The appendix attaches here. You have the ascending colon, which is retroperitoneal. You have the transverse colon. You have the descending colon. The transverse colon intraperitoneal, has a mesentery. Descending colon is retroperitoneal. You have the sigmoid colon, which is intraperitoneal. And note the flexures. You have the hepatic flexure, which is named the hepatic flexure because of its location. It's also known as a right colic flexure. You have the splenic flexure, which is the left colic flexure. It's called splenic because it's where the spleen would be located. And let's take note of some associated structures. Let's look at the hostra and the Tinea coli. The reason you have hostra is the Tinea coli are strands of longitudinal muscle. But since the colon is so much longer than the hostra, it has an accordion-like effect on the colon, so it bunches up and forms these hostra. And of course you have these epiploic fatty appendages. And here's the rectum. Rectum darn near killed him. It was corny, I know. And we are done. Like this video, subscribe, Once again, thank you for your time.